So with this, I would wish to say that through the support of AMREF, of Global Fund, as AMREF, we are glad to be able to be at the center of the largest oxygen infrastructure expansion in the country. CS, through this support from Global Fund, AMREF has procured and distributed over 20,000 medical oxygen cylinders across the country, equipped 14 health facilities with liquid oxygen tanks, 3-ton liquid oxygen tanks. There is ongoing piping and manifold works in 303 health facilities across the country. And I think one of the points to be proud of is, out of the 303 health facilities, we have worked together with SUPKEM, with CHAC and CNNB, the faith-based fraternity, to have at least one FPU facility per county benefiting from this, amongst from those selected by the counties. CS, when we met you earlier this year, we assured you that we'll be inviting you towards the end of the year to launch oxygen generating plants, PSA plants, that are in hard-to-reach areas of the country. Counties like Lamu, counties like Kwale, Marsabit, Mandera, Wajir, West Pokot, some areas of Laikipia, and Turkana. And just to update you, CS, is that towards the end of this month and for the remainder of the year, we will be asking you to honor the commissioning of these oxygen generating plants that will not only benefit those facilities where they are installed, but they have the capability of refilling medical oxygen cylinders to supply the surrounding facilities, including private, and generate income for those facilities.
Small function, but it's a very important function. And what are we doing? We are strengthening a life-saving element of care in our hospitals. And we are providing a reliable medical oxygen. And this, we are not doing it for the sake of it. It is a constitutional imperative that Kenyans must get the highest attainable standard of health. And with UHC turning that right into a reality, oxygen bridges promise and practice. It's very vital in our emergency care, in our maternal and newborn care, surgery, intensive care, and also during outbreaks. COVID-19 tested our systems. All of you know that. And it prompted both the national and the county government, our facilities, our partners, all of us, to come together, and we rapidly invest in oxygen production, in storage, and in delivery. And I think today what we're doing is we're just laying the foundation for the progress of that. The Ministry of Health estimates that fully upgrading the oxygen production, storage, and distribution across all our existing facilities could require about $232 million. But until today, more than 60 million has already been invested. And this is a very good evidence that when lives are at stake, Kenya must act, and the Ministry of Health must act decisively, and our partners. In 2003, we sought an additional $36 million from the Global Fund for medical oxygen and respiratory care. This consignment we are flagging off today is a very tangible outcome of that reinvestment proposal. And with the Global Fund support, Kenya has installed, and working together with AMREF and other partners, we have installed 14 bulk oxygen tanks, delivered over 1.2 million kilograms of liquid oxygen, and distributed more than 20,000 oxygen cylinders, as our colleague from AMREF has said. And this is a very important milestone to the continuity of care across our country. And I went to King Fahd, and I've seen the work that has been done there. And before that, now they have an ICU, they have a theater, they have a private wing, and today Lamu Island healthcare delivery is amazing. Patients used to be transported all the way to Malindi or Mombasa for just oxygen. But if you go to that place, so when you talk of West Pokot, when you talk of Turkana, when you talk of Marsabit, we are really changing healthcare delivery in our country, particularly in the far-fetched areas. We are very candid ourselves about the remaining gaps, and even readiness in our primary care, shortage of appropriate health delivery. We are over-reliance on cylinders in hard-to-reach areas. We face logistic challenges. We have limited market competition, and that comes to the cost and the need for enhanced provider training on safe, efficient oxygen use. And I'm sure we are going to train our county staff and the people who are going to handle this important shipment. This shipment of today targets frontline use. We are dispatching 420 multi-parameter patient monitors. We are dispatching 10,000 well-out flow meters, and we are dispatching 612 oxygen analyzers to all our 47 counties. And these equipments are so important that they will improve the patient monitoring. They will help us get accurate dosing and make sure we get quality assurance. Allocation follows readiness to maximize the impact. Each county will receive about 10 monitors. Each sub-county will receive 2 analyzers, and let-out flow meters are distributed based on the completed piping works within the facilities. So what are we doing? We are doing what is called sustainability. Sustainability is crucial, is essential, and I urge all our counties and facilities, and even government, to ring-fence funds for preventive maintenance, for calibration, and for spare parts. Equipment, they save lives only when it is functional. If they're not functional, then the equipments are redundant. So every day and on every shift, we must maintain and calibrate and have the right spare parts. I really want to thank Global Fund for financing and AMREF Africa, AMREF Health Africa for procurement support. This partnership, anchored by strong government leadership, how we deliver UHC results. And let me say it here, that these are the kind of things that makes me go to all functions of Global Fund when they're doing fundraising. Global Fund, Gavi. I always tell the DG and the